Hi, I'm Dr. Julie Steinauer. I want to talk to you today about general binocular vision or two-eyed vision problems that either yourself or your child might be experiencing. Now, some symptoms associated with this, and believe me, there's a ton, but you can look at our website for those, which I'll tell you at the end of the video, so watch to the end. But there are a few that are really super common, which would be maybe losing your place a lot with reading or trying to, copy from one item to another, like in book to paper or computer to paper. All right, so that would be something that would be, or board to paper, that would be really, really common. Now, another indicator of a binocular vision problem could be something like forgetfulness or reduced comprehension or poor handwriting. A lot of times my families will say, his or her handwriting is awful, it's atrocious, right? Eye hand coordination issues, spacing issues, whether it be, spacing weirdly on a page, like they write all scrunched up in the corner, or they are like big and blobby over the whole page, and then they write scrunched up at the end, right? Or maybe it's spacing issues of like sitting down in a chair and they're like on the edge or falling off or off to one side. Spacing issues with driving. Okay, there are lots of things. Maybe even spacing issues with walking, where they constantly walk and weave in front of you. All of those things can indicate binocular vision problems. Now, let's kind of understand it a little bit better. So I think let's pause, let's take away a break to understand it just a little bit better. Now, if you have problems using your two eyes together, whether it be from a strabismus, which is an eye turn, maybe an eye that's amblyopic and doesn't see well, that can cause binocular vision problems. But what if it's not those two things and it's just some generalized confusion of the brain? Well, first off, that doesn't happen as often as what you would think. Usually those other two components are in there somehow. But what can happen is if a person, for instance, is reading along a page of print and their brain's not using their two eyes together, sometimes the brain will just block out the image from an eye. Now, it doesn't mean that that eye just goes black and you don't see anything at all. And usually you retain peripheral or side vision with that eye, but the brain can block out like central vision. In order to understand it, though, what you want to do is grab a book or grab a piece of paper. Okay, I'm just going to grab what I have in front of me. This is a list of stuff. And what you're going to do is you want to start kind of reading across it. And then as you read across it, and try to keep it a clip, like a normal pace of reading, just cover an eye and see if that bothers you. So cover an eye for like a second or two and then take it away. And then cover the eye again. Then you might switch eyes and see if it bothers you whenever you do something like that. Okay, so the other thing is that if you have problems using your two eyes together, stuff can possibly even shift. So that can cause you to lose your place, and some of these other things that I talked about, like it will affect your comprehension overall, could affect your handwriting, your spacing ability, and judgment of space. So what on earth do we do about it? That's always the question, and how severe is it? Well, it depends. It depends on what it's doing to affect your life or the life of your child. But if it's affecting you in any way, then it's probably severe enough. Now, what we do to correct it is we use two different types of treatment. One that you hear me talk about an awful lot is our photosyntonics, or our light therapy goggles. These are actually utilized in order to help train the brain electrically how to process vision better again. Whether we're sending kind of electrical signals to the muscles of the eyes to do something different in alignment, whether we're triggering the brain to process information more quickly, whatever it is that we're doing, there is a filter pretty much for it. All right, and this helps with the brain processing information. In fact, what's really cool, if it happens to be problems with reading and comprehension and that kind of thing, usually people who leave our program jump anywhere from 3 to 7 grade levels with reading. That is so awesome. And we absolutely love it when kids are super excited that they jumped in their ability to read. It's amazing to see those changes, and they love it. They're super excited to read too. But so let's go back and talk about what else do we do besides syntonics? How do we get the brain kind of processing vision better? Well, it's a combination of syntonics with the filters I just showed you, and also a bit more of a mechanical type of procedure where we're kind of training the brain more mechanically over a period of time, doing similar things over and over and over again. Okay, and also so think of it like tracking, focusing, eye alignment. There's a lot of things that we do there. We also incorporate in that more mechanical side a lot of body coordination activity, which is super important to coordinate vision better and to understand our space. And then the other things that we do in this too are making sure that once we've got everything coordinated accurately, we have to have the ability to judge space well. So depth perception, maybe space around us. There's a lot of components to this. So it's electrical and a bit more mechanical, and also kind of conceptual in nature, where we're teaching you how to understand space, but getting something that we call projection and perception, which is understanding where your eyes kind of point in space versus where stuff actually is located. And there can be discrepancies in that. Woo! If that sounds like a lot, it kind of is, but we're super successful in treating patients who have binocular vision problems. And you may feel like, oh my gosh, this is me, or it's my child, and if that's the case, well then definitely contact us. If you're local, you want to call us at 618-288-1489. If you're not local, which means you're not in the same state or you're not in driving range, maybe you're even overseas, then yes, you can still work with us, but what you need to do is go to our website where you'll have two choices. At this point, you get to choose. Do you want more information and want to learn? Then you should go to clicking on the questionnaire and filling out a questionnaire where we'll contact you and obviously do research. And then the second thing is another option is that you can just schedule a consultation direct with me if you want to hear how we can help you. Now, if you like this video, hit like. We would love it if you pass it along and share it to someone that you know who could benefit from it. And also subscribe to our YouTube channel. Thank you.